So let's quickly talk about the staphylococcal infections. And under the staphylococcal infections, here we talk about staphylococcal infections in depth, talk about the characteristics, the signs and symptoms, the causative organ and microorganisms, all right? But we'll be focusing on the virulence. Do you know what is virulence? Virulence is basically the characteristics, all right, or what the microorganism possess to be able to cause a problem. All right, so staphylococcal infections, we'll talk about it. We'll also talk about the virulence and everything. All right, so virulence factors to basically talk about the staphylococcal virulence factors. So I want you guys to see this before we proceed. Can you see like pores coming out? Staphylococcus, most of them, they will cause a purulent or suppurative type of what? Inflammation. Right? So let's go down. Let's talk about it. We said that staphylococcal organisms, they are known as what? Pyogenic cocci. That means they are pus forming. All right? When they infect you, they form pus. Okay? So they are pus forming cocci that grow in clusters and they are distinctive for their local destructiveness. Right? So basically, if they infect here, they will destroy here. You understand? Unless they spread to another side. Do you understand? They infect that specific place. All right? So they are distinctive for their local destructiveness, cause a variety of skin infections, including boils, carbuncles, impetigo. Okay, all these are skin infections, right? All these are skin infections. Then they can cause osteomyelitis, which is infections of the bones. They can cause pneumonia, which is infection of the respiratory system, infecting the lungs. They can cause endocarditis as inflammation of the endocardium. They can cause food poisoning. They can cause a toxic shock syndrome. That's when your body reacts adversely to their toxins. All right. So less virulent ones cause opportunistic infections. Less virulent, that means that the ones they are less likely to be so harmful. Okay, so they can cause opportunistic infections. Opportunistic infections is basically like a type of infection that you get when your immune system is already weak. Okay, so the less virulent ones can cause opportunistic infections like what? The Staphylococcus epidermis is mostly found in what? People that what are intravenous drug abusers. You transfuse drug through your veins too much, right? And this organism can get in. And also patients that are with catheters or with prosthetic heart valves, okay? Then Staphylococcus saprophyticus causes what? Urinary tract infections, right? This is not divided into upper or lower tract, okay? So Staphylococcus saprophyticus can cause what? Urinary tract infections, right? So you can see staph infections that are skin related. You see the boils that we're talking about, cellulitis, there's infection in hair follicles, there's impetigo, right? There's what? Paronychia, which has to do with the nails, all right? So now let's focus on the virulent factors. And I have this image here, which will be actually will be referring to. Now let me define what is a virulent factor again. Virulence factor is basically like the characteristics or the features that these microorganisms possess for them to be able to cause a damage in human beings. Okay, so for the virulence factors now, the virulence factors include the following. We have the surface proteins. Basically, they have surface proteins that allow for host cell adherence, right? T protein A and the rest. So they have a surface proteins that will aid them to be able to attach to the host cell. Okay, and they also have enzymes that will degrade host proteins. Okay, enzymes that will degrade the host proteins. You can see hyaluronidase. You can see the staphylococcus. You have the leukocidin. You have the leukotoxin. You have the coagulase. You have the staphylococcus. All these are enzymes that will basically what? Your enzymes have to break down, so they'll degrade the host proteins, promoting invasion and tissue destruction. So also their toxin can damage host cell membranes as hemolysins, or they can induce slowing of the skin. That's when you have exofoliative toxins. They can induce vomiting like enterotoxins, or they can induce shock like the super antigens. All right. So antibiotic resistance is a growing problem with this Staphylococcus aureus. Okay. They have been evolving and they are trying to basically resist a lot of antibiotics that are in the markets today. So they can cause infections. So methicillin resistant Staphylococcus aureus can now be a virulent community acquired infections. All right, so this one is very much more resistant to what antibiotics that we have on our shelves today. All right, guys, that's it about staphylococcal infections and staphylococcal virulent factors. All right, so that's it, guys, and bye for now.